K-Tab Air is a mineral supplement that is used to treat or prevent low levels of potassium in the blood. Potassium is essential for the proper functioning of cells, kidneys, heart, muscles, and nerves. Most people can get enough potassium from their diet, but certain conditions like severe diarrhea, vomiting, hormone issues, or treatment with diuretics can lower potassium levels. It is important to take K-Tab Air as directed by your doctor to maintain a healthy potassium level in your body. The usual dosage is 1 tablet daily, but your doctor may adjust the dosage based on your specific needs. It is best to take K-Tab Air with a meal or a full glass of water to help prevent stomach upset. When taking K-Tab Air, it's important to follow your doctor's instructions. To prevent stomach upset, take each dose with a meal and a full glass of water, unless directed otherwise. After taking the medication, wait at least 10 minutes before lying down. Make sure to swallow the capsules or tablets whole, without crushing or chewing them. If you have trouble swallowing the capsules, talk to your doctor or pharmacist. Some brands may be opened and the contents sprinkled onto a spoonful of cool, soft food like applesauce or pudding. Immediately swallow the mixture without chewing, and drink a glass of cool water after each dose. Take this medication regularly at the same time each day to get the most benefit from it. The dosage is based on your medical condition and response to treatment, so do not increase your dose or take it more often than prescribed. The recommended maximum dosage is 20 milliequivalents per dose. If your condition does not improve or if you experience symptoms of low potassium in the blood, such as irregular heartbeat or muscle weakness/cramps, be sure to consult your doctor. If you experience upset stomach, nausea, vomiting, gas, or diarrhea, let your doctor or pharmacist know. It's also normal to see an empty tablet or capsule shell in your stool, as your body has already absorbed the medication. Your doctor has prescribed this medication because the benefits outweigh the risk of side effects. Most people don't experience serious side effects, but you should contact your doctor if you have trouble swallowing, feel like the tablet is stuck in your throat, vomit coffee ground-like substance, have severe abdominal pain, or notice black/tarry stools. While allergic reactions are rare, seek medical help if you have a rash, swelling, severe dizziness, or trouble breathing. If you notice any other effects, contact your doctor or pharmacist. Remember to follow your doctor's advice on the best time to take this medication, the daily dosage, and any specific benefits for your condition. It's important to let your doctor or pharmacist know about any allergies you may have before taking K-Tab Air. This medication may contain inactive ingredients that could cause allergic reactions. Before using K-Tab Air, make sure to inform your doctor or pharmacist about your medical history, particularly if you have heart problems, kidney problems, or high levels of potassium in your blood. There have been rare reports of stomach/intestinal ulcers and bleeding with sustained-release potassium products, so it's recommended to take a liquid form of potassium instead. If you have throat/stomach/intestinal problems such as blockage, narrowing, or ulcers, be sure to tell your doctor or pharmacist. Before undergoing surgery, make sure to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. If you are considering using other potassium supplements or salt substitutes that contain potassium, it's important to consult your doctor or pharmacist first. Too much potassium can lead to serious side effects. If you are pregnant, K-Tab Air should only be used when clearly needed. Be sure to discuss the risks and benefits with your doctor. Additionally, potassium can pass into breast milk, so it's important to consult your doctor before breastfeeding while using this medication. When taking K-Tab Air, it's important to be aware of potential drug interactions that could affect how the medication works or increase the risk of serious side effects. Make sure to keep a list of all the medications and herbal products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. If you are regularly taking other medications that can raise your potassium level, such as certain ACE inhibitors, angiotensin receptor blockers, or potassium-sparing water pills, be sure to inform your doctor or pharmacist. It's also important to let them know if you take medications that can slow down the movement of potassium in your stomach or intestines, as this could increase the risk of side effects. This includes certain antihistamines, antispasmodic drugs, bladder control drugs, and drugs for Parkinson's disease. It's important to discuss any concerns or questions about potential drug interactions with your healthcare provider before starting K-Tab Air. Additionally, it's important to follow the recommended daily dosage and take the medication at the optimal timing as advised by your doctor. If someone takes too much K-Tab Air and experiences severe symptoms like fainting or difficulty breathing, it's important to call for emergency help. For those in the U.S., you can call the local Poison Control Center at 1-800-222-1222. Canadian residents can reach out to their provincial Poison Control Center. Signs of an overdose may include an irregular heartbeat, muscle weakness, and confusion. It's crucial to seek immediate medical attention if any of these symptoms occur. Now, let's talk about the uses of K-Tab Air. It's important not to share this medication with others. While taking K-Tab Air, you may need to have lab and/or medical tests to monitor your potassium blood level and kidney function. It's important to keep all medical and lab appointments and consult your doctor for more details. It's also important to eat a well-balanced diet while taking K-Tab Air. Foods high in potassium include bananas, oranges, cantaloupe, raisins, dates, prunes, avocados, apricots, beans, broccoli, spinach, potatoes, lentils, chicken, turkey, beef, and yogurt. It's best to consult your doctor or dietitian for recommended foods. Remember to take K-Tab Air as directed and at the optimal time for you. If you forget to take a dose, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one. Take your next dose at the regular time. Don't take 2 doses at once to make up for the missed one. When it comes to storing K-Tab Air, it's important to keep it at room temperature, away from light and moisture. Make sure to store it in a place that's not the bathroom and keep it out of reach of children and pets. If you no longer need the medication or it's expired, be sure to properly dispose of it. You can consult your pharmacist or local waste disposal company for guidance on how to do this. And remember, never flush the medication down the toilet or pour it into a drain unless specifically instructed to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.